NCLEX Practice Test 2026 National Council Licensure Examination, Full Course. What is NCLEX? Question 1. What does NCLEX stand for? National Council Licensure Examination. National Care Licensure Exam. Nurse Care Licensure X-ray. Nursing Council Licensure Entry. NCLEX stands for National Council Licensure Examination. Question 2. Which category is the largest part of the NCLEX-RN test plan? Psychosocial integrity. Management of care. Health promotion. Pharmacology. Management of care is typically the largest content category, 15 to 21%. Question 3. The category Safe and Effective Care Environment is divided into which two subcategories? Safety and Infection Control, Management of Care. Pediatrics, Geriatrics. Meds, Surgery. Ethics, Law. It includes management/coordinated care and safety and infection control. Question 4. Which client needs category includes topics like therapeutic communication, physiological integrity, health promotion, psychosocial integrity, safe care. Psychosocial integrity covers mental health and communication. Question 5. Reduction of risk potential focuses on basic hygiene, preventing complications from existing conditions, spiritual health, staffing levels. This category tests the ability to prevent complications, example vital sign changes, lab values. Question 6. What is the main goal of the NCLEX? To rank students. To ensure minimum competence for safe practice. To test advanced medical knowledge. To provide a job. The NCLEX ensures entry-level nurses can practice safely and effectively. Question 7. Which category covers nutrition and oral hydration? Basic care and comfort. Pharmacological therapies. Health promotion. Psychosocial. Basic care and comfort covers hygiene, nutrition, and sleep. Question 8. Health promotion and maintenance includes which of the following? Caring for a patient on a ventilator. Techniques of physical assessment. Managing a psychiatric crisis. Wound care. It covers pregnancy, birth, and early detection/prevention. Question 9. Who is eligible to take the NCLEX? Anyone with a high school diploma. Graduates of approved nursing programs. Only doctors. Medical assistants. You must graduate from an accredited RN or PN nursing program. Question 10. Where can you take the NCLEX? At your nursing school. At a Pearson VUE testing center. Online at home. At the hospital. The exam is administered at Pearson VUE centers. Question 11. Which document outlines the content covered on the exam? The NCLEX test plan. The nurse's handbook. The ANA Code of Ethics. The Hospital Policy Manual. The NCLEX-PN publishes a detailed test plan for RN and PN candidates. Question 12. What is a select all that apply, SATA, question? A question with only one right answer. A multiple response question with one or more correct answers. A question where you pick the best of 4. An essay question. SATA questions are multiple response items. Question 13. Physiological integrity is composed of how many subcategories? 2, 3, 4, 5. It includes basic care, pharmacology, reduction of risk, and physiological adaptation. Question 14. The next generation NCLEX, NGN, was introduced primarily to test speed, clinical judgment, memory, calculations. NGN focuses on the clinical judgment measurement model, CJMM. Question 15. Which question type asks you to click on a specific part of an image? Hotspot, ordered response, fill in the blank, matrix. Hotspot items require identifying a specific area on a graphic. Question 16. True or false, the NCLEX uses a fixed number of questions for every student. True. False. The exam length varies based on the CAT algorithm. Question 17. In an ordered response item, what are you required to do? Rank items in order of priority or sequence. Choose the best answer. Type a number. Select multiple options. Ordered response items involve sequencing, example steps of a procedure. Question 18. What is the maximum time allowed for the NCLEX exam? 3 hours. 5 hours. 8 hours. Unlimited. The current maximum time is 5 hours. Question 19. Which item type provides a clinical scenario with multiple parts? Case study, multiple choice, bowtie, trend. Case studies present a realistic scenario that evolves through several questions. Question 20. Pharmacological and parenteral therapies includes which topic? Administering blood products, changing a bed, patient rights, birth control education. This category covers medications, IVs, and blood products.